Hello, my name is Dr. Susan Marra, and this is Dr. Marra's Medical Minutes. And today we're going to talk about elevated cholesterol. So, lots of patients have elevated cholesterol. They can have elevated total cholesterol, elevated particle cholesterol, elevated bad cholesterol, which is LDL, elevated HDL, which is good cholesterol. They can have elevated triglycerides. They can have any of a myriad of different variations of elevated cholesterol. But, and let me explain why that happens. One of the reasons that you get elevated cholesterol in tick-borne disease is when these organisms are en route to the intracellular component of a cell, like Lyme, Bartonella, they pierce the cell membrane, which is a phospholipid bilayer largely made of cholesterol. And in so doing, they cause an injury to the cell membrane. And a signal is sent from the cell membrane that gets received by the liver and signals the liver to increase the production of cholesterol. And that cholesterol then gets carried down to repair the cell membrane. So it's a cellular repair mechanism. Now, that's not always the case. You can have elevated cholesterol from the diet that you eat. If you eat a lot of fats, then you're going to have elevated cholesterol. There's also a genetic piece to this. So you can have a genetic propensity for elevated cholesterol. I'm talking about the elevated cholesterol that happens as a result of infection. Now, there is another type of elevated cholesterol where you have high triglycerides, low HDL, and you have a elevated insulin resistance score. This is the precursor of diabetes, and we also see this in infection and tick-borne illness a lot as well. It's the result of a dysregulated metabolome, and this needs to be evaluated. And one of the tests that you can do to see if your cholesterol is causing vascular or cardiac damage is you can do a cardiac CT scan, and that will help determine whether or not your high cholesterol is causing disease. In my practice, I don't use any of the statin drugs because the side effects are just impossible to manage. But we use a combination of RedRice Yeast, which is natural statin, nonflush niacin, and fish oil, with or without the herb bergamot. And we do that for 6 weeks or 6 months, and generally we get the cholesterol back into normal. Now, that will not affect your elevated triglycerides. The elevated triglycerides really needs to be managed by diet. And so you have to really be careful with fat in your diet. But elevated, total cholesterol or large particle number cholesterol, we can pretty much manage that naturally. And I'm somebody who has been taking RedRice Yeast for 15 years, and because I had slightly elevated cholesterol. We like your cholesterol to be around 185, 190. And your HDL to be 50. If it's higher than that, great. HDL is the good cholesterol. But what we don't want is for cholesterol to accumulate on the inside of your vessels, because that's what causes cardiovascular disease. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.